Osteoporosis is known as something that affects mainly women, which is true, but it can affect both males and females and people of all ages. We took a trip to the Alabama Orthopedic Clinic to learn more about this degenerative bone disease. Here at Alabama Orthopedic Clinic on the campus of Springhill Medical Center with Dr. Whitespunner. Good morning.
Good morning.
We're also joined by our friend Mr. Bones here. That's because we're talking about osteoporosis. What is osteoporosis?
Well, osteoporosis means holes in the bone or porous bone. It means that the bone has gotten weaker than it was. It's typically a problem with aging, but can be seen in other conditions as well.
So is this painful?
It's not painful until you break a bone, and that's why it's very important to test for it before you break a bone so that we can treat problems that can cause bone to weaken. Even with aging it weakens, but there are a lot of other factors that can cause it to weaken, and we like to stop that or slow it down as much as possible before you break something, and that is very painful. Not only is it painful, but it can result in even death. As a matter of fact, the same number of women die from breaks caused by osteoporosis each year as die from breast cancer.
Wow. So you mentioned women. Are women more at risk for this, or who is at risk for osteoporosis?
Well, women are at risk more so than most people, and particularly postmenopausal. Everybody loses 1% of their bone mass or bone strength each year as they age, and women lose more after menopause, so they are more at risk, but men are also at risk also. They don't get off scot-free in this. There are a lot of other people that are at risk that need to be tested earlier in life, people that have diabetes, thyroid problems, people that take certain medications, particularly steroids like prednisone, Dilantin, or some of the anticonvulsants. People that are treated for thyroid get weaker bone faster than a lot of other people do too, and they need to be treated or at least tested earlier.
You're talking about testing. How do we test for this?
Well, typically we do scans, and there are a lot of different scanners that you can test with. Some test your fingers, some test your heel. The gold standard that we use here at Alabama Orthopedic Clinic is the DEXA scanner.
Okay.
And we have a table here.
Can we test me?
We can test you with.
All right, let's try it out.
All right, Joe, we got you ready to get your scan.
All right.
There's no needles, no pain. All you got to do is lie there.
Sounds easy enough.
All right.
Let's go, Bones.
All right, Joe, there's your picture. There's your skeleton. And if you come over to this graph, this shows you way up in the green.
Oh, yeah.
Green is good. Yellow is a warning, and red is osteoporosis.
Okay.
Obviously, you're doing your exercise and taking your calcium and vitamin D and the things you need to do, plus you're pretty young. So
my mom made me drink a lot of milk.
That's a good thing.
All right, so if anyone has any questions, they can come here and get tested?
They can come get tested, and we can talk about results and also whether or not you need to do more than the preventative measures. If you have osteoporosis, we have medications that we can work with to help keep you from breaking the bones.
Dr. Whitespunner with the Alabama Orthopedic Clinic, thank you so much for joining us here on Studio 10.
You're welcome.
We appreciate it. And my bones are good.
Yes, they're great.